Wrench became interested in the Bowen technique as he studied ways to alleviate his wife's severe back pain, and the Australian is one of only a few people worldwide to be taught the technique by its creator. He's here with his wife Elaine and our willing volunteer Carly to explain to us how it all works. Welcome everybody.
Thank you.
Now, I've been reading all about the Bowen technique, but I still can't, in a nutshell, understand what it is. Can you explain that, Ozzy?
Well, it's a soft tissue technique that resets the body to heal itself, whereas other modalities and other disciplines impart the will of the practitioner or the training onto the body. We don't. We do some gentle moves, non-invasive, and step back from the body and allow that body to do its own thing, and the body tells us where the problems are.
It sounds almost magical.
It is. This is what people say. We don't say it's magical, but people call it magical because of the results that it achieves. And it really is holistic in that it addresses everything in the body too, not just work and sport-related injuries, but all the organs of the body, all the systems of the body, gives the body the message. You see, the body has a blueprint in the brain of how it's meant to be. And we just remind the body of that, reset the body, and it's so easy because the work is so simple and yet so effective.
Now, Carly's our willing volunteer. Carly, you've got what we would commonly call frozen shoulder, is that right?
Pretty much so, yes.
Which arm is it?
My left, yes.
And what does it restrict your movement? And
it does, if I put my arms above my head, one will stay forward, which is this one, obviously, and this one will go straight up.
Right. Well, perhaps it would be, if you wouldn't mind starting to address Carly's problem, perhaps talk to me about what you're doing as you're doing it.
Okay, well, as I said, the body will always tell us where the problem is, but we have to ask the body, not in a mysterious way, but we just ask the client to do something. So in this case, Carla, I'd like you to lift your right arm up until you first feel restriction, just slowly, and when you feel a restriction, stop. Thank you. Now put that one down. Now the other one, thanks. And this tells me what nerve or what muscle is caught. So it only goes to there. Thank you. You can put that down. Normally that should go all the way up without any restriction at all. So what I'm going to do for a start is just to move on her erector spinae muscle on her back, and I'll just hold her there, and although you can't see this, it's just a very gentle movement. And then I'm going to go to the posterior border of the deltoid muscle, and I'll ask Elaine to hold the arm up while I just move this muscle. So if you, this is a good what I'm doing is just getting arm to the muscle, and it shouldn't be any discomfort at all too, Carla, and I'll just move that. And Elaine gets a response down the arm. Now, this seems unprofessional, but I give the body a little jar, and it's the only procedure in the whole book where we actually jar the body, but that shrinks or contracts the nerve back into its set position. Now, we do the same here, and if Elaine can just hold that arm, we're trying not to get in the way of the camera to do this.
No, that's good.
And I'm getting again under this muscle, and I'm just going to lift it away from the body, and Elaine carries the arm around, or you can do this without an assistant. We're sitting on a chair, but it's much better if it's done with the client standing. So, and that's all it is, just for the frozen shoulder. Now, normally there would be some preparation where you would lay the patient down on a bench and you would relax the whole body with what we call basic relaxation moves. And then you would stand the person up, but we've just gone straight to this, and it's like a first aid move. But if you, Carla, just shake your shoulders now a little bit, thanks.
Carly, how did it feel when Ozzy was touching you?
How did it feel? It's hard to explain, really. You definitely feel a flick, if anything. Yes, definitely more sore on this side, obviously.
Yes.
But I was surprised, yeah, just that little flicking movement. It's very small, yes.
Okay, now, if you don't mind, if you just carry your right arm out at right angles, does it go up any easier than it was?
It was, it is actually, yes.
And this was the...
this is the bad one.
Bad one, and if you just take that up.
Oh, look at that.
Yeah, that's quite different, actually. Yes, it is.
Now, so you can immediately notice the difference.
Yeah, you will. And this is sort of unfair to Bowen the technique, or to Bowtech, and it's unfair to Carla because what we would normally do is send her away with some exercises just to rotate and bring it up and get it back in a week. But often it responds instantly. But for the frozen shoulder, we've never had one not respond, even if it's been arthritic, calcified, or injured for a long time.
And ideally, I guess Carly as well would see you for a follow-up. Would you perhaps have to see you 2 or 3 times?
Well, sometimes only twice. The majority of Bowen's work was only a couple of visits. because that's the nature of the work, that the body is able to respond. Many cases, of course, long-standing cases do take several visits, but by and large, a couple of visits.
So, Ozzy, what other sorts of ailments can you work with? I know you said it's holistic, but is it largely to do with movement and pain?
It's to do with pain, but it's so brilliant for asthma, you know, asthma symptoms, for infertility problems, for, as I said, any work and sport-related injury. But the real concerns out there today are asthma and, of course, the lymphatic drainage, which drains toxins from the breast tissue, which saves surgery. It's life-saving for breast tenderness. And those moves are so simple. It's revolutionary, really, in what it will do.
You learnt from Tom Bowen yourself,
yes,
which makes you very special, and you've passed on the technique to how many people around the world?
Well, we have 70 instructors now around the world, and we've taught over 17,000 people. We only started in 1986. See, I got into this because Elaine had been in a car accident as a child. I met Mr. Bowen in Adelaide in 1974, and he invited me to train with him. And when I met him, the only thing I said to him, "Pleased to meet you, I'd love to learn from you," and I didn't know anything about him or why I said it. But he invited me down, and Elaine and I spent several years with him, then opened our own clinic and had no intention to teach it, but he said he wanted us to teach it after he died. He had no notes, no charts, all this work was in his head, and he asked us to document it.
Have you come across many people who have poo-pooed this? I mean, have you come in over the last sort of 20 years for some by the skeptics?
Absolutely. Skeptics are the best people of the lot because they don't believe in it and they don't believe it can work, but unless, of course, then we can get them, talk them into trying it. They say, "Oh, well, we'll try it." But yes, there are skeptics and there are people who poo-pooed it, but we've got a lot of people in the medical profession. We've had a lot of research done on this, research projects in the United Kingdom and a lot going on around the world at the moment. We have our 70 instructors at the moment around the world are teaching it in 16 different countries, and there are over 25 countries now in which there is an accredited Bowtech practitioner. And I mention the word Bowtech because unless the work is taught and used correctly, it falls by the wayside. It is simple, but it must be followed very closely. So if anyone was interested in a treatment, what they really should do is seek out a Bowtech practitioner. Bowtech is the company that started this with us, and we're the people that brought it to the world. Since then, any other interpretation that's out there has just been copied from us. People jump on the bandwagon of popularity.
You always get that, don't you?
Yeah, and we were warned about that when we first lectured in America. And so that happens, yeah. But,
well, thank you very much for coming and for demystifying it a bit. I think that's the thing, isn't it? It's about education. It's about people understanding what's available. And as you probably gathered, we're talking about alternative therapies and what have you in our talk back today. So it's most appropriate that you're with us. And thank you. You've been in good hands there. You pleased?
I'm pleased, actually. Very pleased. Yes.
Probably if she tried her arm again now, it would go up further. You see, as the body services that area by putting blood into the area, by correcting it, hour by hour, it just gets better and better.
Can we get Carly to try again then?
Yeah.
Go on.
Oh, yeah. Oh, my goodness, yes.
You see what I mean?
Listen, wow.
Yeah. No, this is what happens. As I said, it was unfair to the technique to say, "Chew me
Just
straight
like
away."
this, yes.
You know,
Well, we
because
appreciate that.
but no, it is. It's very useful. And wish you well. Thank you very much for having us.
Lovely to meet you. Very good. Thank you for coming in, all of you. I should tell you that while you've been watching Ali, Ozzy has been helping a few of us out in the studio. He asked me about my neck, and I could only go to about there, and he did a few little click, click things here, very gentle. And look now, look at that. He's working on one of our camera women as I speak, so we're very grateful to him for being with us this morning. We're bemoaning the fact that Ozzy's had to go because there was a queue out the door for his services. But one of our camera people, Janie, she suffers from pain down her lower back and a sciatic nerve, and he's just had a bit of a feel, and she's flat out on her tummy. Then look at her, there she is. She's fine. It's just that Ozzy said, just lie there for a wee bit, Janie, just to relax a bit. So we've lost a camera person for the time being, but she'll be with us shortly. We've had a fax here. We're talking about alternative medicines today, but we've had a fax here from Margaret in Hamilton, and she was interested in what we saw Ozzy Wrench doing with the Bowen Technique. And and is asking how Jane, our camera woman, got on because this Margaret has got problems with her sciatic nerve as well. Janie says that her lower back's feeling really good. She's got something's going on. Something is continuing to go on down her legs, so she's quite encouraged by it. But certainly, Margaret, if you want to find out more about it, then Bowtech is on the internet, and you might want to have a look and see where they are in your area. Thank you for that. Oh, today, haven't we? Sharon's in New Plymouth. Hi, Sharon.
Hi, how are you?
Good, thank you.
Oh, that's good. I'm just ringing up about Bowen treatment. I've just had major back surgery, and the only way I could get round was on crutches or in a wheelchair. And I had family turn up over the weekend, and they took me into a health food shop in New Plymouth, and a lady by the name of Rachel gave me some Bowen treatment. And by the time I got home, I was able to actually walk with no pain in the back and get round. So these people that poo-hoo alternative treatments need to sort of go into it a bit more.
So you definitely put your ability, your movement, down to the Bowen Technique as opposed to the surgery that you'd had?
Most definitely, because I was having a lot of pain and on quite a cocktail of medication, and I've been able to cut down on the medication, and I go for another Bowen treatment over the weekend. Plus my partner put his back out and he's had Bowen treatment and it's helped him as well. So there's a lot to be said about this Bowen treatment.
Good, and yep, and until you check it out, you don't know, do you? So there we are. That's lots of food for thought for all of us this morning, I think. But it's been good to talk about this. I've enjoyed it. Thank you very much for all your phone calls, your faxes and your emails.